Welcome back, our dear viewers, and with our first distinguished guest for today. On the occasion of World Cancer Day, we highlight the importance of awareness, prevention, and early detection, as well as the vital role of family medicine and health promotion in reducing the impact of cancer on individuals and communities. We are pleased to welcome Dr. Nadia Almahmoud, consultant family medicine, physician, former head of the health promotion section at the Ministry of Health, and a breast cancer survivor, to share with us both her professional medical insight and her personal journey of strength and hope. Welcome to the show, Dr. Nadia.
Thank you for this interview, and I am happy that meet the TV and all the community in this special day.
Of course, and we are so honored to have you with us today. So to begin with, why it's very important, the World Day for Cancer, and how it is very personal for you, on personal level and also on the professional level?
According to the WHO, the 4th of February, yearly all the world will celebrate about this day, and especially for the cancer cases.
Okay.
The importance of this day that educate the community and the people about this disease, and how to prevent this disease, and how we decrease the incidence of the disease, and the increased awareness of the risk factors, and the importance of the screening for the cancer disease. And Kuwait, with all the worlds, will make activities in this special day.
That's really interesting. And also it shows support for those who struggling with cancer, and the survivors, when they remind themselves there's a cancer day being celebrated, and people are contributing in it.
Yeah, of course, because the survivor, they pass this experience with the disease, with the treatment, and they have the chance to educate also the new cases of the cancer, that they can fight it, they can survive, and they can return to their normal life.
Exactly. So it's raising hope and raising also awareness at the same time, telling people there is still a chance that you really can survive, and look at the examples before you, so to make them even stronger in the future.
Yeah, of course.
That's really awesome. And what does from a family medicine perspective, how can family primary care help in reducing the cancer prevention?
Yeah, the family medicine, it is a branch of the medicine, is very important in the community, because it is the first line of defense and the first contact with the community. They are screening, their role, screening for the cancer, educate the people about the importance of making the screening test, because it will protect their life and prevent the increased incidence of this disease.
Okay.
So they are very important for the screening, also for the management. If they detect any high-risk people, they will do the investigation for the screening. For example, the mammogram for the lady, the PSA for the male, for colonoscopy for high-risk group. And also, if they detect any abnormality, they directly refer the patient
to the
specialized unit.
Okay.
So they get the proper plan management for their cases. This is very important. Early detection is very important, that make the survival
exactly, in terms of early detection, they say time is money, and they also say time is health. So how can early detection prevent patients from reaching a very high stages level of cancer?
Thank God the medicine now more updated and more become more advanced, and we have a specialized screening test to detect the disease in the very early stage. So we prevent the spread of the cancer in the body, and also start the treatment in the first stage, and the treatment, it will be more effective.
You have more control over
more
the
control
disease.
for the disease, and this will increase the survive rate, and also the education for the community about the important the healthy lifestyle. This will protect our body from all the diseases, the chronic diseases.
Like a healthy lifestyle for someone who's like on healthy practices, different from someone who's like going through the day, eating maybe like fast food or like having some bad habits like smoking. And nowadays, like we have a trend of vapes, like people take like the electronic cigarettes.
Yeah.
So what kind of like lifestyle that could really lead to cancer?
High risk factors, these are the, it's not the main cause, because still all the research, they talking about the risk factors. The risk factors we have related to the genetic, related to the age, related to the, for example, family history, and the other risk factors related to the life itself. The obesity, increase in the weight, the smoking, hormonal, if they are some, especially the young, they will take the hormone for become more, you know,
like for the bodybuilders.
Builders, and also for the lady, if she is taking hormonal for example, contraceptive pills or hormonal to increase estrogen in the body. This also
like for
increase
the
the
ladies
risk
at the same time?
if the estrogen,
like the higher level of estrogen and the higher level of testosterone?
Yeah, therefore we advise the community that they should aware of their life. They should live in a healthy life. This will prevent the incidence of the disease itself. The exercise is very important. We are all advised that the exercise, this will protect their body from all chronic diseases and also the cancer. And also not only for the prevention, it's also for the treatment and to prevent recurrence of cancer who already survived from the cancer.
Yes,
so
definitely.
it is like a treatment with the prevention.
Like precautions.
Yeah, precaution.
Precautions and like exercises help strengthening the immune system, correct?
So, yes.
That's really amazing. And beside like from the lifestyle, diving deep to the patient themselves, as someone who survived the breast cancer and you experienced that, how that changed your way of communicating with the patients? They say like we have a famous saying that say, اسأل الطبيب ولا اسأل المجرب واسأل الطبيب. But you, mashallah, like both, you are someone who experienced that, at the same time you are someone who educated yourself and reached the PhD in that level.
The disease itself make the patient recognize his life, recognize what his life before the disease, and what there is something in his life that make the disease, he get the disease. So if he is a smoker, he should recognize this risk factor and he should stop it. And if he is obese, he should try to reduce his weight and take healthy diet and also exercise to reduce his weight. If any lady that if she had any risk factors, for example, family history or something, she should screen also for the genetic. The other things, stress itself. Stress, if it is chronic stress, this will reduce the immunity in the body, increase the cortisol in the body, and this will make the cancer cells to spread and to be active.
Exactly,
So
like stress,
relax,
the door, the gateway for a lot of diseases and mental issues as well.
Yeah, it should be mental and physical healthy.
A collaboration of different factors that
yes.
could really help you to become stronger in fighting and surviving, inshallah, the cancer stages. And with that, like, what one message you would like to share with people who are undergoing through this experience?
They have a lot of information to give it to other people. The survivor also, they pass the stage of the treatment. They know the side effect of the treatment, how they can override the side effect, how they make it less, how they make their life so easy, how they try to...
so you mean like their communication with their patient?
Yeah.
Or like their...
communicate with the community with healthy people and also with already new cases of the cancer. And they give the hope to the patients that it's no more killer disease. It's not killing. There is more advance in the medical side that they can it will be treatable and they can return to their normal life.
That's really amazing. And that's the same with you, right? When you like talking with your own patient.
Yeah, of course.
It changed the way you communicate with them.
Yeah, it changed my life exactly 180 degrees, because I think of the importance of the education for the people more. Most of the community, they ignore their body, ignore their health. They don't know that if they are young, they will feel that they are strong. But if they live in a not healthy lifestyle,
yes,
after age 40, 50, they start to have the chronic diseases and they will have more chance to get the cancer. So I feel it is very important to educate the people about
raising
this
awareness.
Disease. Yes.
Especially like for patients, their families. Because sometimes families could be like really a good support, or they could be the ones who really take you, like make you feel give up.
The family really supporting the patient all the time, alhamdulillah. We are, if we feel we are Kuwaiti and also non-Kuwaiti, we are Arabic, we like our family. Our relationship inside is very strong, alhamdulillah. And this is very important to give support to the patient during the disease and during the treatment and even after survival.
Of course, that's
it's
really
very important.
Definitely. And finally, on World Cancer Day, what is the most valuable message you would like to share with the audience or the patients that will give them like hope and survivorship in the future?
Yeah, and this day and this special day today, we all celebrate in the hospital, in the KCC. There is big events, and also you will find most of the survivors, they are sharing their hope with the patients and inside the hospital and in the community. And we are, as a survivor, we thank the Ministry of Health, and also we thank the TV, the Kuwait TV, that they gave us this chance to communicate with the community and educate them. And thank you for this.
On behalf
interview.
of the Ministry of Information, we thank you and we appreciate your valuable time and the golden tips that you have shared for the audience so they can know how to deal with the cancer disease and how they can prevent it in the future. Thank you so much, Dr. Nadia Almahmoud.
Thank you. Thank you for this interview.
And now, dear viewers, we're going to take a quick break and then we're going to be back, so stay tuned.